Ladies and gentlemen, thank you for standing by and welcome to the LA County COVID-19 update. At this time, all lines are in a listen-only mode. Later, we will have a question and answer session. If you wish to ask a question, please press 1, then 0. At this time, I'd like to turn the conference over to Supervisor Kathryn Barger. Please go ahead.
Thank you. Good afternoon, and thank you for joining us here today. I'm Supervisor Kathryn Barger, Chair of the Los Angeles County Board of Supervisors. Dr. Christina Galley, Director of the Department of Health Services, will share an update on the modeling data for our hospital capacity, which she previewed last week. This critically important analysis will help the county and state assess our ability to gradually reduce our safer at-home orders. We remain committed with our health partners to safely ease restrictions so people can return to work and reunite with loved ones. Keep in mind, science and data will guide our decisions. Meanwhile, many are still coping with stress because of the complete uncertainty this crisis has caused. For example, there are those who have pets who have the added burden of wondering where our animals will go if we get sick. Los Angeles County Department of Animal and Care Control, along with our animal care advocates, have provided some suggestions for pet owners to eliminate this uncertainty. These guidelines encourage careful planning, not just because of COVID-19, but in case of an emergency. Pet owners should identify at least 2 trusted people who can care for your pet when you can't, ideally someone that your pet is familiar with. Post the contact information for your appointed caretakers in a place where it can be easily found by emergency personnel when they arrive at your home. Otherwise, in the moment of an emergency, your pet may get taken to a shelter instead of to a trusted caretaker. Also, carry a copy of the contact information with you at all times, so this information is always accessible and even when you leave home. Make sure to create a document for your designated caretakers that list your pet's daily care instructions, special needs, vaccination records, and the veterinary contact information. This is also a good reminder to microchip your pet and include the microchip registry in those documents. At all times, have at least 2 weeks' worth of your pet supplies, including food, treats, and medication. Finally, always have a license tag and identification tag on your pet so they can make it home safely. These are critical steps to keep pets in safe and loving homes, even if you are unexpectedly unable to care for them. The Department of Animal Care and Control has created a video with these reminders and more information to keep our furry friends safe and well cared for throughout this crisis. Please visit covid19.lacounty.gov to learn more. Again, covid19.lacounty.gov. And with that, I would now like to invite Dr. Barbara Ferrer up, our Director of Public Health, to give you the latest numbers. Thank you.
Good afternoon, everyone, and thank you so much, Supervisor Barger, and I want to thank the entire Board of Supervisors as well. These are unprecedented times, and I know I'm grateful, and I know that the entire county is grateful that we have such tremendously powerful leadership that's been extraordinary about creating a path forward for all of us. So I'm grateful that I work for you, but I'm also grateful that as somebody who lives in Los Angeles, we have these amazing leaders that are really setting forward a course that will get us to the other side. I do want to update you today on our current status. I'm sad to report an additional 66 deaths. 48 of the people who died were over the age of 65, and 38 people who were over the age of 65 and passed away had underlying health conditions. 13 people are between the ages of 41 and 65, and 9 of these people also had underlying health conditions. There are 2 people who were between the ages of 18 and 40, and both had underlying health conditions. We do not have this information for the 3 cases that are being reported by the City of Pasadena. This brings the total number of deaths across LA County to 729 people. 89% of the persons who have died from COVID-19 did have underlying health conditions. And this underscores the need for all of us to do the best job possible in making sure that people who have serious health conditions are able to stay home and be safe, avoiding close contact with others as much as possible. For the 646 deaths where race and ethnicity has been identified, 15% were African American, 18% were Asian, 37% were Latinx, 27% were white, and 2% of the people who passed away identified with another race or ethnicity. As more people in our county lose their loved ones to COVID-19, please know that the county family mourns with you, and we keep you in our prayers every day. We're reporting 1,318 new cases today. This brings the total number of cases in LA County to 16,435 cases. These cases include 477 people reported by our partners in the city of Long Beach and 261 people reported by the city of Pasadena, both of which have independent city health departments. We're also confirming that there were 100 cases amongst the positive cases that are among people experiencing homelessness. 55 of the people who were experiencing homelessness were sheltered, and they are now appropriately isolated, and their close contacts are all quarantined. As a reminder, the large increase in the number of persons experiencing homelessness who were residing in a shelter were because of the outbreak that we have at the Union Rescue Mission. And again, I want to thank everybody who's working, Housing for Health, and Andy Bales and his entire team for really making sure that the space at the Union Rescue Mission remains safe for the people who are quarantining and isolating in place. We are conducting investigations at 8 different shelters, 7 additional shelters, and in those shelters we also are identifying staff and guests that need to be tested, isolated, and quarantined. There are 3,902 people who are positive for COVID-19 who at some point have been hospitalized. This remains at 24% of all of our positive cases. There are 1,791 people currently hospitalized, and 30% of the hospitalized patients are in the ICU, and 19% are on ventilators. We're currently investigating 275 institutional settings with at least 1 confirmed case of COVID-19. This is 6 new investigations since yesterday. These investigations are happening across nursing homes, assisted living facilities, shelters, treatment centers, supportive living, and correctional facilities. The total number of confirmed cases in our institutional settings has risen again to 3,115, and this includes 1,826 people who are residents and 1,289 people who are staff. And I'm sad to report that 292 residents who resided in institutional settings have died from COVID-19. And this represents 40% of all of our deaths. And the majority of the people who passed away who were living in institutional settings were in fact residing in our skilled nursing homes. We are working this week to increase our capacity to offer COVID-19 testing at institutional settings where there are outbreaks. This will include testing where appropriate for both symptomatic and asymptomatic residents and staff. And I will talk a little bit more about that in a minute. We're also reporting 96 confirmed cases at some point in time among people who are either working or incarcerated in our jail facilities. This includes 34 inmates and 62 staff. The Sheriff's Office is reporting current numbers for their facilities. There are 21 people who are incarcerated who are positive, 13 people who are incarcerated who have recovered, 65 people who are incarcerated who are in isolation, and 1,586 inmates that are quarantined. There are 69 cases in the state prisons, and that includes 54 inmates and 15 staff. There are 68 cases in the federal prisons, and that includes 66 inmates and 2 staff. And there are 11 staff working in our juvenile facilities who have tested positive for COVID-19. We do post daily information by facility that includes the number of positive and suspect cases among residents and staff. And by the end of this week, we will be able to include the number of deaths by facility for these institutions as well. And as a reminder, you can see an updated report every day for all of the LA County cases on the Department of Public Health's website at publichealth.lacounty.gov. The Los Angeles County Sheriff Department is reporting 58 positive cases among their staff, 364 staff that are currently quarantined, and 535 staff that have returned to work. The LA County Fire Department is reporting 17 positive cases among their staff, 6 staff that are quarantined at home, none who are in isolation, and 17 that have returned to work. I want to thank Sheriff Villanueva and Chief Osby for continuing to give us this valuable information every day. We're now have completed tests for over 90,000 people in Los Angeles, and their results have been reported to the Department of Public Health. Among the 90,000 people that have been tested to date, 15% were positive. And I do want to encourage people to get tested if they have symptoms. The test is fairly easy. It only takes 5 to 10 minutes, and it's safe. There are appointments available at the regional testing sites, and you can find testing sites and make an appointment online at covid19.lacounty.gov/testing. I wanted to spend a minute just giving an update on the steps we're taking to address the increasing number of outbreaks in skilled nursing facilities and the corresponding increase in the number of deaths. We are saddened, as are all the people who work at the facilities, with the continued rise in both people being sick who are at the facilities and people passing away. And I want to make sure that we're working hand in hand with all of our partners to do everything we possibly can to protect residents and employees who live and work at these sites. With the new information that's emerging that indicates that there are many more people than we thought who are positive for COVID-19 and they're not sick, we have to change our strategies and adjust. This is particularly true at all of our institutional settings, particularly at the skilled nursing homes, where in the past we have done a lot of our infection control protocols around an assumption that we needed to worry about people who were symptomatic and test people who were symptomatic and not allow people who were symptomatic and were employees to come into a facility to do their jobs. But it turns out that we were wrong, and with new information, it's become clear that asymptomatic people are capable of spreading the virus. And this is particularly true in a facility where all of the care for most of the residents happens because employees are bathing people, they're feeding people, they're moving people, they're in extraordinarily close contact with the people who reside there, and really helping to make sure that those people have what they need every single day. But in having what they need, it's become clear that part of that is our obligation to make sure that we're able to test all residents and employees for the virus, regardless of whether they show symptoms or they don't. And we have to make sure that we're able to maintain this level of testing for the months ahead. This will allow us to make sure that residents and employees who are positive for COVID-19, even if they have no symptoms, are immediately isolated from others, even when they're not sick. And we know that this will help prevent the spread of the virus among these most vulnerable residents of ours. We're working very closely with the Department of Health Services in the state to increase our capacity to offer appropriate testing at those sites that currently have COVID-19 cases. And I also want to acknowledge our partnership with the city to help make sure that there's testing capacity available. Starting tomorrow through May 10th, we also have 5 new members from CDC who are joining our staff, and they will help us do visits to the skilled nursing facilities and insist with improving all of our infection control practices at sites, and that's particularly focused on making sure that the sites can do a good job isolating and quarantining residents as appropriate. 2 will be reporting to us starting tomorrow, and the others will be coming to stay with us or work with us in the days ahead. Each person on that team stays with us for 1 to 2 weeks on their assignment, and some will be able to extend past the 2-week assignments. We're also receiving assistance from the state, and I want to thank the governor and Dr. Mark Galley for all of their help. A full-time medical officer and 2 additional half-time medical officers will be assisting the Department of Public Health with outbreaks that are happening at our skilled nursing facilities. And in particular, they're going to be training public health nurses to support infection control practices at every single facility. We have a lot of public health nurses who have been working as part of the investigation teams, but we need to make sure that they have ample opportunity for increased training, particularly around infection control protocols. We're also working really closely with EMS, and I want to thank the entire EMS team, to prioritize personal protective equipment at skilled nursing facilities. Over the course of this week, 2.8 million masks, 8,000 gowns, 200,000 gloves, 50,000 face shields are being distributed to over 300 skilled nursing facilities. And depending on bed capacity at each site, each skilled nursing facility is receiving between 5,000 and 16,000 masks. Healthcare workers at the skilled nursing facilities, hospitals, and other service providers are taking extraordinary measures to make sure we're conserving PPE, personal protective equipment, as we face shortages at every level. But we're encouraging all of our healthcare facilities to work with us to make sure that they have contracts with vendors to prevent us from running out of personal protection equipment in the months ahead. And I also want to note that there are now decontamination services for N95 respirators in the county so that they can safely be reused. We will continue to work with our partners at EMS and across the county to advocate for adequate PPE supplies from state and federal stockpiles. And as we receive more from the stockpile, we will continue to work across the county to prioritize healthcare workers and other frontline workers who are serving our highest risk populations. We will continue to update you as we try our best to do a better job protecting those who are most vulnerable. I do want to thank everyone for continuing to follow the Safer at Home order. And I know the weather is getting more beautiful by the day, and we all want to be outdoors. And I think it's great, and people should try to make sure that they are getting outside. But we need you to do this while observing the Safer at Home order, which asks that when you're out, you need to, A, use a cloth face covering if you're near other people, and B, keep your distance. So you do need to maintain that 6-foot barrier between you and all others. It's very important, even with the good weather, that people do not congregate together outside. So enjoy the outdoors alone or with other members of your household. And this means please take a walk, go for a jog, or sit outside in your yard and allow your children to be outside and enjoy this beautiful weather. But you need to do it as a household and not to congregate in places and spaces that are beautiful but will defeat our need for us to keep our distance still. So physical distancing does remain core to our strategy to slow the spread, and I thank you for all that you're doing. Now it's my pleasure to introduce Dr. Christina Galley, the Director of Health Services.
Hi, I'm Dr. Christina Galley, the Director of the Department of Health Services. Thanks for joining us today and for all of your time and your efforts to help us manage COVID-19. About 10 days ago, the Department of Health Services at this press conference released the findings from the projection modeling effort that's been led by DHS and the county to inform our understanding of how the physical distancing measures are impacting the spread of COVID-19 across the county and also the associated demand for hospital beds and the demand on the broader healthcare system. I'll provide a brief update on that modeling projections today. The data shows that to date there continues to be a leveling off of the cases of COVID-19. However, new infections are not yet decreasing, and we continue to have a need to maintain physical distancing measures to prevent an increase in cases of COVID-19 and to avoid excessive strain on the hospital system across the county. Before I walk through the findings, I want to just take a step back and express my appreciation for everyone across the county and all that you are doing. The leveling off that we see in the cases of COVID-19 is because of you. It's because of your compliance with the Safer at Home Health Officer Order. It's because of your efforts to physically distance when you are outside of the house. It's because your efforts to hand wash, to wear the cloth mask, and to do everything that has been outlined through the public health orders that have come forward. And those steps are working, and I'm very grateful for your efforts. I know it's not easy. Some of you have lost loved ones. We mourn with you, and I know that these times are incredibly difficult, and our deepest sympathies are with you. I know for many of you, your lives are upended in financial and economic ways. People have lost jobs, and the bills are growing. There's rent to pay, and I know that these are stressful times financially for many. And then there's the stress and the mental health impact that we're all feeling about the uncertainty that lies ahead, concerns about getting sick, concerns about caring for those around us, as well as the stress of being within our homes, outside of our normal social circles, away from work, away from school, and whatever used to fill our lives. And I know that that's difficult. My goal in sharing these ongoing modeling projections with you is to provide as much clarity as we can, with the caveat that we've shared all along, is that there's a lot of uncertainty in any model and in any demand projections that we could provide. That's the nature of a virus like coronavirus and the disease of COVID-19, is that we can't be absolutely sure, and no model is a crystal ball that can accurately and perfectly predict anything that is to come several months out. The uncertainty, I know, makes things very difficult, but we do know that the slowing of the rate of spread of COVID-19 in the county is because of your efforts, and again, I'm grateful. So we do have to keep this up. Because physical distancing is the best tool that we have, we need to make sure that we continue it. And as the county looks in the coming weeks to start to relax the Safer at Home Health Officer Order, it will be done in a very careful and gradual way, with a focus on how we can maintain physical distancing when we're outside of our homes to the greatest extent possible, while still seeking to relax the measures and allowing society to get back to business as usual. Now I'll shift to the slides and start to walk through the specific hospital demand projections as a result of COVID-19. I want to offer my thanks and my appreciation to Dr. Roger Lewis and his entire modeling team that he assembled with individuals within and outside the county, and I'm just grateful for all of their work. The first slide shows the number of new cases of COVID-19 that are seen every day within our hospital systems. You'll see that the number is not yet decreasing, but it is leveling out, which is a good thing. 10 days ago, our best prediction was that we were going to see a continued increase in the daily number of new patients, but we weren't sure how rapid that rise would be and how steep that slope would be. Instead, as a result of physical distancing, our current best projection is that the number of new cases will remain steady, as you'll see on the white line on the slide. As with any model, as I've indicated, there is still a degree of uncertainty, and you'll see that range of uncertainty on this slide and on the future slides as the red shaded bar. If our system is overrun by new cases of COVID-19 after physical distancing is lessened, or if people go outside of their homes and disregard the physical distancing orders, then the rate of infections will drastically increase and the curves would shift to a sharp upward trend. What this means, again, is that physical distancing continues to be the key tool that we have in holding the epidemic in check across the county, and is what we need to do to make sure that we can continue to manage the number of patients that are arriving at hospitals across the county. On the next slide, you'll see the overall usage of beds. We'll continue to see and predict, based on the model, that we're able to be well positioned to meet the demand for hospital beds. So this shows with the white line, again, a leveling off of the curve of the number of patients that require hospitalization at any one time. And you'll see that the range of uncertainty is shown by the red band continues to be below that red dotted line, which represents the available capacity of beds for treating COVID-19 patients. While we project that we can continue to meet the demand for patients, please keep our finite supply of hospital beds in mind. And it will be affected by two things moving forward, which will continue to change these slides. First, our overall supply of beds can change. That's both because we can bring beds more online in the future as we add additional licensed care, unlicensed bed settings within our hospitals, or bring on the alternative care outside of hospital bed capacity like the Mercy Ship or the Lash. But it's also affected by a hospital's or alternative care site's ability to adequately resource those beds. And namely, that's dependent, as I've mentioned before, on supplies and staffing. Healthcare workers have been one of the many heroes of the COVID-19 response across the county, in this county, across California, and nationwide. But we have to remember that they're also human, and if a hospital's ability to staff its bed changes, then we have to reduce the available bed capacity, even though at the same time we're working on steps to increase staffing pipelines, such as some of the work that the state has done with the Health Corps website. Second, in addition to the supply of beds, which is extremely contingent on staffing, there's also the demand for beds. This could change really based on two things. One is a sudden demand for services, a sudden surge of cases as might be brought about by a relaxation of the physical distancing measures in a non-gradual way. But it can also be brought about if there's an increase in cases that come to be cared for within hospitals that's above the normal rate of hospitalization for COVID-19 patients. And we'll continue to watch those two trends very carefully. On the next slide, we shift to a focus on ICU beds. Our anticipated ability to be able to meet the demand for ICU beds also continues to improve. If you recall, 10 days ago, the model indicated that there was more than 50% likelihood that we would not have enough ICU beds in the weeks ahead and that we needed to bring more online. Now, at this point in time, the current available ICU beds is projected to be sufficient if physical distancing measures are maintained. We're still working to bring more ICU beds online and still working to make sure there's adequate staff and supplies for those beds, but this is a good trend in that red band of uncertainty is below the dotted line of available ICU capacity. On the next slide, you'll see ventilators. Even within the range of uncertainty represented by the red band, we are still in a position where we can meet the need for patients who require mechanical ventilation across the county, with the red band solidly below the dotted red line on the slide. The next slide. With that in mind, it's important that we also talk about the impact of physical distancing outside of our hospitals. As you know, the rate of COVID-19 patients who require hospitalization is small. It's only 2 to 3% of those who are infected. And often people say, well, does this mean that we can just relax the rate of physical distancing because the overall need for hospitalization is small? But just to be clear, this would be a tremendously risky strategy, and there is a still tremendous risk of a high burden of illness if those measures are relaxed too soon. If physical distancing doesn't continue or is relaxed in a non-gradual way, then by August 1st, we still project that nearly all Angelenos across the county, about 19 out of 20, would have been infected. And if we maintain our current levels of physical distancing, that falls dramatically to on the level of about 2 in 20. And if we're able to tighten up physical distancing even more over the next 3 weeks with people's compliance with the safer at home order, then we can reduce that rate of infection to 1 in 20 among all Angelenos, adults and children. There is, of course, uncertainty in these projections, and as we learn more about the number of people that have been infected, such as through the seroprevalence studies that are being led by the Department of Public Health, the projections will change and we'll update you on those in the future. In closing, I want to reiterate that we continue to make progress and the spread of COVID-19 has flattened out and leveled out. But relaxing physical distancing measures very suddenly would negate and reverse all of that progress that we've made to date. So while I know we all look forward to the relaxation of the safer at home order and the physical distancing measures, we also need to remember the role that physical distancing has played in helping us to get a handle on the cases and helping the health system be able to withstand the volume of patients. I know it's hard. I know a lot of us are feeling the weight of these restrictions and are eager to be able to get out of our houses more and back to work and back to school. But please know that your actions have saved lives and are protecting the lives and health of those around you and those you love. This will end, and until then, thanks for your perseverance in these difficult times. With that, we'll turn it over to questions. Thank you.
Okay, ladies and gentlemen, if you do wish to ask a question, please press 1 then 0 at this time. Our first question will come from the line of Ryan Carter, Los Angeles Daily News. Please go ahead.
Thank you. Doctors, thank you so much again. So it sounds, well, I wanted to get a little bit clearer on testing capacity versus the number of tests that are actually occurring each day. I guess my question is, it sounds like that testing capacity is about over 11,000 a day, but the number of tests per day going up don't seem to be by that much. And I was curious if you could kind of hone in a little bit for me on why there is that disparity. And then just kind of in line with that, I wondered if you have a goal on testing where people can anyone can get tested in the county, regardless of symptoms or not. Thank you.
Sure, this is Christina Galley. Those are great questions, 2 great questions. So on your first question, yes, the capacity for testing as measured through all of the different sites where patients can get access is on the order of 10 or 11,000 a day. There's so many different sources of how patients can get access, so it's available not just through the publicly offered testing sites, but also through the private sector. But the number of people that are getting tested is much lower than that. And as we see in the drive-through testing sites, not all of those slots are getting filled every day. So there is capacity if people want to get tested, and we're actively looking at the locations of those test sites, trying to think through different ways in which we can distribute the test capacity more broadly in a better geographic sense to be able to meet people's needs, also trying to raise awareness about the availability of test slots within all of those drive-through sites. And then we're also doing additional work to make sure that we're doing proactive outreach among vulnerable populations and repurposing the available test kits that are out there to be able to expand testing among particular populations, whether it's certain geographies, whether it's the skilled nursing facilities or congregate living facilities that also need improved access to testing, whether it's homeless shelters or encampments with people experiencing homelessness. We need to do more work, and we'll be able to share more detail on this in the near future as we get the maps and the data in a better place about how we can better match the demand for testing with where the supply currently exists. On your second question, also very timely, the goal. There's a lot of numbers that are being thrown out there right now, and I don't think they've all landed in one place. People have thrown out a number of 1% a day of a population that needs to be tested. Some people say 1% a week. This is something that's being actively discussed, I know, on the state, national, local level by public health departments to make sure that they arrive at what the optimal number is. As with all things, it's going to depend on the specific demographics of a local area. So whatever is the number that's ultimately put forward by the state and by the national government, we'll need to make sure that that makes sense for the unique epidemiology of the disease across the county. And so we'll put forward what that goal is and how it will be implemented in the coming days. Next question.
That question will come from the line of Rob Hayes, ABC 7 Eyewitness News. Please go ahead.
Good afternoon. A follow-up on that last question. I know it was asked. I don't know if it was completely answered, though, but will the county reach a point when testing will be accessible to anyone without symptoms, and how far off do you think that will be? And then a question after that, will the county conduct autopsies on or test bodies of people who died of COVID-like symptoms all the way back in February?
I'll take the first question, and then I don't know if Dr. Ferrer wants to also weigh in with respect to serologic testing. So I'll answer it with respect to molecular testing. So the clinical usefulness of testing right now is primarily among symptomatic individuals for all the reasons that we've talked about before. Just the value of a negative test in the setting of someone who doesn't have symptoms doesn't have broad usefulness. Now, there are exceptions to that. If you have an outbreak in a skilled nursing facility or in a homeless shelter, shelter or an encampment, and you're worried about the risk of that positive index case spreading to other individuals or staff or residents in that site, then there would be an indication for doing asymptomatic testing of other individuals within the location. But at this point, there is not thought to be broad clinical value among the whole population for just anyone getting tested if they don't have symptoms. So that's one of the things that we're working on, is rolling out the capacity for both all people who have symptoms to have access to molecular testing, ideally as integrated as possible within their health system, and then also expanding the capacity for those special situations, the congregate living areas, for example, to be able to have the capacity to do the asymptomatic surveillance testing that needs to be done. That's separate than the serology testing, which might have a broader clinical applicability among asymptomatic populations, which I'll let Dr. Ferrer answer. And then on the autopsy, I don't know. Dr. Ferrer will answer that question. Thank you.
I'll start with the second one, just in terms of the autopsies, because I know that's a lot of concern for people, particularly with the new data that showed that, way back, we actually may have started seeing deaths from COVID-19. So Dr. Lucas is our medical examiner and our coroner, and, he's actually amazing. And even early on, he was actually helping us figure out which cases may need some testing after the person has died. So we're working closely with him to try to figure out which cases that actually went through the medical examiner's office ought to have a test to see whether or not they were possibly infected with COVID-19. I do want to note that many people who passed away early on in February or even earlier may not be able to test them any longer. So I want to put that caveat out there that everybody, it's not possible to go back and test everybody who passed, who might meet the criteria that we would set forth for trying to figure out whether or not we were starting to see deaths earlier. But we can have Dr. Lucas available to answer questions through his communications office for you on the specifics of how he's been handling that. And I just want to reiterate that on a move-forward basis, there is testing for people after they died to determine whether or not, if they had respiratory illness, even after they died. This is particularly happening when people are dying rather quickly, that they may not have been tested before they passed away, in which case they would be tested after they passed away. And again, these are terrible situations for families to be in, but that testing is available. I do want to talk for a second about serology testing, which really is most useful right now just to measure how many people may be infected at any one point in time across the entire county. And these would capture people who were infected and never had any symptoms, as well as people who were infected and showed some symptoms. It just doesn't give you information at the point of time where they're tested whether or not they have an active infection or they had a past infection, because we're not measuring virus. We're measuring the antibodies to the virus. Until we have more information that tells us whether or not having antibodies offers you a lot of protection or a little bit of protection or no protection at all, we would not use serology testing to determine sort of a clinical care, make any clinical care decisions, or even make decisions about whether you're safe or not safe to be around others and not infect them or get infected yourselves. Like, we don't have the science there to tell us that, but it does help us understand how this virus is spreading through our communities. And that is going to continue to be important in the months ahead. One particular usefulness of the serology testing is it will let us know if some people have had more exposure and become more infected than other people. For example, healthcare workers. If we tested them with the antibody test, would we have a higher rate than the 4% we found amongst the general population? And I think that information is just useful, again, in designing the strategies that we want to use to protect everyone as we go through the weeks ahead. So, but it's a very different kind of test than the molecular test that tells whether or not at this moment in time you can infect somebody else. We'll take the next question.
That will come from the line of Steve Gregory with KFI News. Please go ahead.
Thank you, and good afternoon, all. I wanted to ask Dr. Galli real quick if the USC research that was done recently impacted the modeling, or was that too late? What's the timeline there? Also, Dr. Ferrer, you mentioned yesterday, I believe, about coming out with stats on restaurants with outbreaks, and you sort of kind of glossed over that. I'm wondering if you can give us a number of how many restaurants that you're talking about, and is it a big problem and an issue? And to Madam Chair Barger, taking a page from Mayor Garcetti the other day when he announced the furloughs and cutbacks within his administration within the city, I'm wondering when the citizens of LA County can expect some sort of a cutback or furlough list from the county. Thank you all.
Hi. For the first question, I'll turn it over to Dr. Roger Lewis, who led the modeling work and can give you an answer to your specific questions.
Great, thank you very much. Yes, the modeling team is using the results of the seroprevalence studies that are done in Los Angeles to help us calibrate the model and to make sure that the modeling that we're doing is consistent with the data that are being developed by the USC and Department of Public Health teams. We also look at the seroprevalence studies that are done in other communities to look at the variety of results people are getting. So the answer is yes, we're absolutely using that information, and the projections that you saw today are consistent with those seroprevalence data that came out earlier this week. Thank you very much.
Yes, and thanks for the question about restaurants. We will be adding restaurants to the list as time goes by. Obviously, we get more calls to do investigations where employees in restaurants have become positive. So we're going to, if there's one positive case and we're doing an investigation, we'll post that information on our website. I just want to note some caution on sort of restaurants and other places that aren't really traditional institutional settings. Sometimes people who work in different places, even in the county, get infected and have to stay home, and they're isolated and their close contacts are quarantined, but they actually neither had an exposure at work. They know what their exposure was, and it wasn't a workplace exposure, and they also weren't at work for a while. So particularly with all the teleworking that people are doing, I do want to note that just because a person is positive and they may work somewhere doesn't mean that the workers or customers in a particular location were actually exposed. That's why we do the investigations. We try to figure out, was this employee here? What other employees may they have been in contact with? Remember, you go back 48 hours from the time a person becomes symptomatic or they're known to be positive, and then try to figure out what the exposures were. But we are going to include restaurants. We hope that'll be on, before the end of the week. But thank you.
And then on the last question, LA City's budget process is different than the County of Los Angeles. At this point, there are no recommendations to do furloughs. We are putting the budget together. But again, just because LA City is doing the work furloughs doesn't necessarily dictate that the county or any other city is going to do it. So for LA County right now, work furloughs are not on the table. Thank you. Next question.
That will come from the line of Claudia Puchetta, KNX News Radio. Please go ahead.
Hi. Do you have an idea of how much more testing capacity you would need in the county to do regular surveillance testing in nursing homes and other congregate living facilities? And also, I'm wondering if this might extend to in-home health workers who could also spread the virus among high-risk people as they go from one home to another. Second matter, serious concerns have been raised about the data that's coming out of the antibody study. I'm wondering if any adjustments are being made in subsequent rounds of testing. And given those concerns, will the data still be used to make decisions on when and how to lift restrictions? Also, I believe kids were not included in the first round of testing, and I'm wondering why not. Thank you.
Hi, I'll take the first part of your question about testing, and then I'll turn it over to Dr. Ferrer for the second part. On the skilled nursing facilities, another great question. We are working to better understand that volume of testing that's needed in the skilled nursing facilities as compared to the available supply of tests. There's 350 nursing homes across the county. They have about 40,000 beds in them. And as you know and hear daily, the number of infections is constantly moving. So we're working on projecting the need for testing, including testing of asymptomatic populations, and then comparing that with what the supply of testing is, which is also moving. So right now there's some test capacity within the skilled nursing facilities. The state is providing some mobile test kits to be able to enhance testing within skilled nursing facilities. They're also in the process of rolling out additional test capacity that it will be supported by the state that could be deployed either in a nursing home facility setting or other settings, and we want to be able to balance where that test capacity would best fit. And then obviously also if we can address the supply chain challenge, mainly on swabs, then that would free up test capacity within the larger commercial lab vendors who have enough test platform and extraction kits and reagent to be able to run tests if they have sufficient collection swabs on the provider side to be able to run them. So we're taking all of these different factors, and then we'll be putting forward, as I've mentioned, some concrete numbers about what's the volume of tests that we're seeking to get at over the next 1 month, 2 months, 3 months, and ongoing.
Thanks, Claudia, for the question on the serology testing. Even when we presented the findings last week, we did talk about the fact that it's a range because there are statistical adjustments that are being made to account for the possibility. In this case, for the test we used, the antibody test that we were using, we needed to really account for the fact that there could be a fair number of false negatives. The test that we're using doesn't really have any false positives associated with it right now, but that does create this range that you have to use, and I think that might be why you keep seeing some different numbers thrown out. There really was a range somewhere between 3.6% and 6.2% of people who live in LA County may have already been infected. You know, we're going to repeat that study every 2 to 3 weeks. We'll have more people in the sample because every time we add 1,000 people, and that allows us to have, you know, more certainty about the results, which means the range that we give you can shrink because our numbers are bigger. So, you know, I look forward to being able to get to a more exact number, but, you know, given the sample size and the fact that this test had some it had only 79% of the time where the negatives actually stayed negative. So you had about 20% of a 20% chance of the negatives actually being positive. You have to really adjust for that when you make sort of these assumptions about how many people would that lead us to believe could be infected at any point in time. But we'll continue to give you good information on that, and feel free to call us, and then you can talk to Dr. Simon, and he can give you more detail if that's helpful.
What about kids?
And,
They asked about why kids weren't included.
oh, yes, why young people weren't included in the study. I will say that we do have a lot of interest in serology around young kids. It's a very different study design. You do have to get a lot of permissions, and it will take longer to get clearance for that. But I would agree with you that it would be very useful to understand, particularly since even when you look at our data, you can see we have less than 200 people under the age of 18, I believe, 18 and younger, I believe, that have been infected, have been tested positive. It's a very, very small number. So there's a lot of interest in whether or not they're asymptomatic carriers of the infection, and we're working on that as well. So hopefully we'll be able to do something with the antibody testing and get those questions answered. We'll take the next question.
That'll come from the line of Dave Lopez, Channel 2 News. Please go ahead.
Yes, good afternoon. Doctor, 3 quick questions, if I may. The number that you gave today is surpassed 1,000. That did not include a backlog. You had mentioned that you would hit that number eventually. Is that because of the number of tests, or should we be alarmed by that number?
Yeah.
A quick question on the Santa Clara study. In your own professional opinion, is there any way that you could guess or have an estimate as to the earliest case that Los Angeles had? And my final point is you said to people, don't go to Ventura, even though they're lifting their restrictions. Are you giving the same request for Orange County?
Yeah, I mean, yes, I love the last question, so let me take that first. Yes, please, we ask you to stay at home. That's sort of the directive, and that really means, please try not to travel to other places where they may be lifting some of their restrictions. Every county is different. As everyone knows, we have a lot of illness in our county, and we have high rates of people who are dying. We know that it's best right now for us Angelinos to really stay home, stay outside your own yard or your own neighborhood. Please don't go driving to other beaches. And I'm being honest, when you go, you run the risk, because there'll be many more people there, of running into people who are asymptomatic, but they're able to infect you, and then you will bring that infection back to LA County. And we absolutely don't need that. Everyone here has worked so hard to keep their distance. So I urge you to stay here, home, in LA, not travel to other counties. And I think other counties would appreciate that as well. They want to try to reopen just for their own residents. Nobody benefits from people doing a lot of travel now and going and congregating in any spaces or places. People make their decisions based on what they think is best in their communities, but that really reflects not having people traveling to other counties so that they can, in fact, congregate in places that aren't really meant for them to be congregating. So we're going to ask you all to stay home. I do want to answer the question about Santa Clara and the fact that, it looks like there was an early death. Do we anticipate there were early deaths here? I think everybody in public health would say that we anticipate that there were many more early deaths across the country that weren't captured. Even when we were watching what was going on in China, back in January, we were all suspicious of whether or not we didn't have cases circulating at a small enough number that it wasn't creating alarm, because remember, that's the height of our flu season, that were going undiagnosed. In hindsight, we should have probably looked more carefully, particularly at deaths. But I think, again, hindsight is beneficial as we move forward. It doesn't really help us understand what might have happened in the past. So I think it's unfortunate we might not have that information, but we would anticipate that across the country, particularly in travel hubs like LA County is, that we were probably seeing some infection much earlier on than what we were able to diagnose. And then the last question that you asked was, what was happening with our case count. So we still are reporting today some backlog of labs. That's going to continue for the next few days for sure, and even into next week as we catch up with some of the newer sites that aren't on our electronic lab recording, lab record system, so reporting system. So I want to note, yes, not as many as yesterday. Yesterday was hundreds and hundreds, but yes, we still have a significant number of labs that we're reporting today that were from last week. But I do want to note we also have an increase in cases today. So, and we anticipated this, and we've spoken of this since the beginning, that as we do a better job with testing, we will identify more people that are positive, and as there's more infection that's circulating, we will have more people that are positive. So thanks for your questions, Dave. We'll take the next question.
That comes from the line of Melanie Mason with LA Times. Please go ahead.
Hi, this is a question for either Dr. Galley or Dr. Lewis with regards to the models. In the slides that you put out today, you put out the 3 scenarios and projected if we maintain current levels of social distancing, that we would have an infection rate of about 11%, give or take, in the county by August 1st. That's a pretty substantial reduction from the numbers that you put out a couple of weeks ago, where it was 30%. And I'm wondering if that's due to a change in the construct of the model or real-time data coming in, if you can explain the difference between those 2 figures.
Great, I'd be happy to do that. It's a great question. So if one looked back at the slides that were presented back on the 10th, there was quite a range of uncertainty regarding the trajectory that the epidemic was going to take in LA County. It included the possibilities that the number of cases would be relatively flat. It included the possibilities that it could go up quite quickly. When one averages over all that uncertainty, or as we did about 10 days ago, the average number of cases we expected if we maintained the current level of physical distancing was, as you correctly state, around 30%. But the new data that came in that Dr. Galley presented today showed that, luckily, and this is good news, that the number of cases has been in the lower range of the uncertainty we had with the prior model. And based on that new updated information, the revised estimate is around 11%, as you state. And of course, there's uncertainty around that estimate as well. And as new future data comes in, we expect to be able to be more precise in that estimate. And then lastly, I just want to emphasize that that's all contingent upon us maintaining the same level of physical distancing that we have been able to achieve to date.
We'll take one more question.
That comes from the line of Louisa Marshall with NBC4. Please go ahead.
Thank you for taking my question. My question is for Dr. Ferrer. We've been following the pop-up testing site for the homeless population. So I want to ask, how do you get more homeless people to come for testing? In the past years, when workers have had to get the homeless to agree to get vaccinated, they gave restaurant gift cards as an incentive. Is that something that the county would consider?
No, I think it's a great question, and I don't think it's just a question for homeless people. I think it's a question of making sure people understand the importance of the test, because we have other populations that are also not necessarily showing up for testing right now. And I think from the public health department's perspective, we need to do a better job communicating to people that it is important to be tested, particularly if you have symptoms. Some people are scared, as they are with any kind of testing. I'd rather not know the results than know the results. We've heard people who they're scared, they think the test hurts. And we've heard other people say that they don't trust that the test results are going to be kept confidential and or that it's going to make a difference. So I think for people experiencing homelessness and for other people in our populations, in our communities, we need to do a better job explaining to people, all of the protections that you have and that this data is in fact confidential. It is not shared. I give numbers, but they're not attached to any people, and we don't share any information with other people about test results. I mean, that's protected information. Your provider could have it, you can have it, but it never gets released to the general public, and your names are always stripped off of the information that comes to us at the public health department in terms of the counts. And I do know what you're saying, that, you know, in the past when we've tried to vaccinate folks, we've had resistance, but I think it's the same strategy. It's less about offering incentives, I think, than it is about making it easy for people, barrier-free for you to get tested, making sure that the tests are accessible, that people understand why it's important to get tested, and then that we're going to make sure that they get services if they're tested. I think a lot of people are worried, like, if I'm positive, like, what does that mean? How am I going to isolate? What does that mean for my family? What does that mean for my job? So we'd like to work with all of our community partners and our media partners to make sure that people understand the importance of testing and that we're here as a county family. This goes across all of our departments to make it easy for people to both get tested, and Dr. Galley and her team are doing an amazing job expanding that capacity. And all of the other county departments are there to make sure that if you are positive, we have resources to support you and your family so you can safely stay home and isolate. And now we're going to move to remarks in Spanish. Thank you very much.
Buenas tardes. Para actualizarlos, hoy estamos tristes de reportar 66 muertes adicionales. Esto eleva el número total de muertes a 729 en el condado de Los Ángeles. El 89% de las personas que fallecieron a causa de COVID-19 tenían condiciones delicadas de salud, lo que enfatiza la necesidad de que las personas con problemas graves de salud se queden en casa y eviten el contacto cercano con los demás, tanto como sea posible. Para las 646 muertes en las que se ha identificado la raza etnia, el 15% son afroamericanas, el 18% son asiáticas, el 37% son latinas, el 27% son blancas y el 2% se identifica como otra raza etnia. Hoy estamos reportando 1,318 casos nuevos. Esto eleva el número total de casos en el condado a 16,435. Estos casos incluyen 477 casos reportados por nuestros colegas en la ciudad de Long Beach y 261 casos reportados en la ciudad de Pasadena, quien tienen departamentos de salud independientes. Estamos reportando 100 casos confirmados entre personas sin hogar. 55 que fueron protegidos están apropiadamente aislados y los contactos cercanos están en cuarentena. Estamos llevando a cabo investigaciones en 8 refugios diferentes identificando personal e invitados que necesitan pruebas, aislamiento y cuarentena. 3,902 casos han sido en algún momento hospitalizados, el 24% de todos los casos positivos. 1,791 están hospitalizados actualmente. El 30% de estas personas están en unidades de cuidados intensivos y el 19% están en ventiladores. Actualmente estamos investigando 275 entornos institucionales con al menos un caso confirmado de COVID-19. 6 investigaciones adicionales desde ayer. Estos incluyen hogares de ancianos, instalaciones de vivienda asistida, refugios, centros de tratamiento, viviendas de apoyo e instalaciones correccionales. El total de casos confirmados en entornos institucionales es de 3,115, incluidos tanto el personal como los residentes. 1,826 de estos casos confirmados son residentes y 1,289 son empleados. Nos entristece informar que 292 residentes en entornos institucionales han fallecido por COVID-19, lo que representa el 40% de todos los fallecimientos. La mayoría residía en centros de enfermería especializada. Estamos reportando 96 casos confirmados en algún momento en las instalaciones de la cárcel. La oficina del alguacil informa por sus instalaciones 21 reclusos que son positivos, 13 que se han recuperado, 65 reclusos en aislamiento y 1,586 que están en cuarentena. Hay 69 casos en la prisión estatal, 68 casos en las instalaciones penitenciarias federales y 11 empleados también que trabajan en instalaciones juveniles han dado positivo. El Departamento del Alguacil del Condado de Los Ángeles informa 58 casos positivos entre el personal, 364 empleados están en cuarentena y 535 empleados han regresado a trabajar. El Departamento de Bomberos del Condado de Los Ángeles está reportando 17 casos positivos entre el personal, 6 aislados en el hogar, ninguno que está enfermo en casa y 17 que han regresado al trabajo. Más de 90,000 personas han sido evaluadas y se han reportado resultados en el Condado de Los Ángeles y el 15% dieron pruebas positivas. Quiero animarles a hacerse la prueba si tienen síntomas. La prueba es bastante fácil, solo toma de 5 a 10 minutos y es segura. Hay citas disponibles en los sitios de prueba regionales y puede encontrar sitios de prueba y hacer una cita en línea en covid19.lacounty.gov/testing. Hoy quiero actualizarlos sobre los pasos que estamos tomando para abordar el número de brotes en centros de enfermería especializada y asegurar de que estamos haciendo todo lo posible para proteger a los residentes y empleados que viven y trabajan en estos sitios. La nueva información que tenemos, cual documenta que hay muchas más personas de las que pensamos que son positivas por COVID-19 y que no están enfermas, afecta cómo protegemos nuestros residentes más vulnerables en hogares de ancianos. Una estrategia es asegurarnos de que en nuestros hogares de ancianos podamos evaluar a todos los residentes y empleados para detectar el virus y no limitar solo a evaluar a aquellos con síntomas. Esto nos permitirá asegurarnos de que los empleados y residentes que son positivos por COVID-19 estén inmediatamente aislados de los demás, incluso si no están enfermos, y pueden ayudar a limitar la propagación del virus. Estamos trabajando estrechamente con el Departamento de Servicios de Salud y el Estado para aumentar nuestra capacidad de ofrecer pruebas apropiadas en aquellos sitios que tienen casos de COVID-19. Empezando mañana hasta el 10 de mayo, 5 miembros del personal del CDC se unirán al Departamento de Salud Pública y su función será visitar centros de enfermería especializada y ayudar a mejorar las prácticas de control de infecciones. 2 se reportarán al Departamento de Salud Pública mañana y los otros tendrán horario variable durante su tiempo aquí. Cada personal se quedará entre 1 a 2 semanas y algunas podrán extenderse más allá de las 2 semanas. También estamos recibiendo asistencia del Estado, un oficial médico de tiempo completo y 2 oficiales a medio tiempo nos ayudarán con los brotes en centros de enfermería especializada y capacitarán a enfermeras de salud en el control de infecciones. Hay enfermeras de salud con mucha experiencia en el control de infecciones y hay muchas otras que tienen experiencia en otras áreas. 8 enfermeras con otra experiencia serán capacitadas en control de infecciones y también trabajarán con nuestros centros de enfermería especializada. Se está capacitando 2 enfermeras de salud pública adicionales para ayudar a revisar el historial clínico del hospital para comprender quién se está enfermando gravemente. También hemos estado trabajando estrechamente con nuestro Departamento de Servicios de Emergencia para dar prioridad a los equipos de protección personal en los centros de enfermería especializada. En el transcurso de esta semana vamos a distribuir 2.8 millones de máscaras, 8,000 batas, 200,000 guantes, 50,000 protecciones faciales llamadas face shields, en más de 300 centros de enfermería especializada. Dependiendo de la capacidad de camas, cada centro de enfermería especializada está recibiendo entre 5,000 y 16,000 máscaras, un promedio de 8,000 por instalación. Los trabajadores de salud en los centros de enfermería especializada, hospitales y otros proveedores de servicios médicos están tomando medidas extremas para conservar el equipo de protección personal a medida que enfrentamos escasez en todos niveles. Alentamos a las instalaciones de atención médica a contratar a proveedores que brinden servicios de descontaminación para respiradores de N95 para que puedan volverse a usar de manera segura. Continuamos trabajando con nuestro Departamento de Servicios de Emergencia y otros socios del condado para abogar por suministros de equipo de protección personal de las reservas estatales y federales. Tan pronto como recibamos más equipo, daremos prioridad a los trabajadores de salud y a las poblaciones de alto riesgo. Continuamos evaluando la necesidad de centros de enfermería especializada más allá de esto. Queremos agradecerles a todos por continuar siguiendo nuestra orden más seguros en casa. Es muy importante que no nos congreguemos con otras personas. Disfrute del aire libre con miembros de su hogar o solo. Salga a caminar o a correr. Pero recuerde, el distanciamiento físico sigue siendo importante para frenar la propagación del COVID-19. Y ahora vamos a remarks in Armenian. Now we're going to remarks in Armenian.
Բարի օր բոլորին։ Շնորհակալ եմ վերահսկիչ Բարգերին եւ վերահսկիչ մարմինների ողջ խորհրդին։ Ես շատ շնորհակալ եմ ձեր ղեկավարությանը այն ամենի համար, ինչ դուք արել եք Լոս Անջելես շրջանի բնակիչների համար այս դժվարին ժամանակահատվածում։ Ներկա իրավիճակի վերաբերյալ տեղեկությունները հետևյալն են։ Այսօր ցավով հայտնում ենք եւս 66 մահվան մասին։ Այս մարդկանցից 48-ը 65 տարեկանից բարձր են եւ որոնցից 38-ը ունեցել են ուղեկցող առողջական խնդիրներ։ 13 անձի տարիքը 41-ից 65-ն է եւ 9-ը նույնպես ունեն ուղեկցող առողջական խնդիրներ։ Երկու անձը 18-ից 40 տարեկան էին եւ երկուսն էլ ունեին ուղեկցող առողջական խնդիրներ։ Մենք չունենք այս տեղեկությունները 3 դեպքերի համար, որոնք մեզ հայտնում են Փասադենա քաղաքից։ Սա բերում է ընդհանուր մահերի թիվը 729-ի Լոս Անջելես շրջանում եւ մահերի տոկոսը COVID-19-ից կազմում է 4.2%։ COVID-19-ով մահացած անձանց 89% ունեն ուղեկցող առողջական խնդիրներ, ինչը կարևորում է այս անձանց ովքեր առողջական լուրջ խնդիրներ ունեն մնալ տանը եւ հնարավորինս խուսափել սերտ կապերից։ 646 մահվան դեպքերի ռասա էթնիկ պատկանելիության հետևյալն է։ 15%-ը աֆրոամերիկացիներ են, 18%-ը ասիական, 37%-ը լատինեքս, 27%-ը սպիտակ, 2%-ը ճանաչվել են որպես մեկ այլ ռասա եւ էթնիկ ազգություն։ COVID-19-ով մահացած մարդկանց ընտանիքների եւ ընկերների վիշտը ճնշող է։ Մենք սգում ենք ձեզ հետ եւ մեր մտքերն ու աղոթքները ձեզ հետ են։ Այսօր հայտնում ենք նաեւ 1318 դեպքերի մասին։ Ընդհանուր առմամբ 16435 դեպք է գրանցվել Լոս Անջելես շրջանում։ Մենք հայտնում ենք 100 հաստատված դեպք անօթևան մարդկանց շրջանում։ 55-ը, որոնք ապաստան են ստացել, պատշաճ մեկուսացված եւ սամ կապերը կարանտինացված են։ Հոսպիտալացման տվյալները հետևյալն են. 3902 դեպք, ինչ որ պահի հոսպիտալացվել են, որը կազմում է բոլոր դրական դեպքերի 26%-ը։ Ներկայումս հոսպիտալացվել են 1791 մարդ, որոնցից 30%-ը գտնվում են ինտենսիվ խնամքի բաժանմունքում, իսկ 19%-ը միացված են շնչառական օդափոխիչների։ Ինստիտուցիոնալ բնակության հաստատություններ։ Ներկայումս քննություններ են կատարվում 275 ինստիտուցիոնալ բնակչության հաստատություններում։ Դրանց թվում են ծերանոցներ, ապաստարաններ, բուժման կենտրոններ, օժանդակվող բնակելի հաստատություններ եւ քրեակատարողական հիմնարկներ։ Ինստիտուցիոնալ միջավայրում հաստատված ընդհանուր դեպքերը 3115-ն են, անձնակազմ եւ բնակիչներ։ Այս դեպքերից 1826-ը բնակիչներ են, 1289-ը անձնակազմ։ Ցավով ենք հայտնում, որ այս հաստատություններում COVID-19-ով մահացել են 292 բնակիչ, որոնք կազմում են բոլոր մահերի 40%-ը։ Մենք զեկուցում ենք, որ հաստատված 96 դեպքեր արձանագրվել են քրեակատարողական հիմնարկներում, 34 դատապարտյալ եւ 62 աշխատող։ Շերիֆ Շերիֆի գրասենյակը զեկուցում է, որ իրենց հաստատություններում ներկայումս 21 բանտարկյալներ տեստավորվել են դրական, 65-ը մեկուսացված են, 1586-ը կարանտինում են, 69 դեպք նահանգային բանտերում, 54 դատապարտյալ և 15 աշխատակազմ, և 11 աշխատակազմի դեպք անչափահասների հաստատություններում։ Մենք տեղադրում ենք հաստատված դեպքերի ցուցակը մեր կայքում աշխատողների, բնակիչների և ընտանիքներին տեղեկացնելուց հետո։ Եվ Լոս Անջելես շրջանի արձանագրված բոլոր նոր դեպքերի զեկույցը կարող եք տեսնել առողջապահության վարչության կայքում publichealth.lacounty.gov։ Շերիֆի և հրշեջ վարչության աշխատակիցների տվյալները։ Լոս Անջելեսի շրջանի շերիֆի վարչությունը զեկուցում է 58 դրական դեպք անձնակազմի մեջ, 535 կարանտինի մեջ են, 294 վերադարձել են աշխատանքի։ Լոս Անջելես շրջանի հրշեջ վարչությունը հայտնում է 17 դրական դեպք անձնակազմի մեջ, 6-ը մեկուսացված են տանը, 17-ը վերադարձել են աշխատանքի։ Շնորհակալություն ենք հայտնում շերիֆ Վիլանյուվային և պետ Օզբին այս տվյալներին հետևելու և զեկուցելու համար։ Տեստավորում։ Ավելի քան 90,000 մարդ տեստավորվել են և արդյունքները զեկուցել են Լոս Անջելես շրջանում, որից 15%-ը դրական են։ Ես ուզում եմ քաջարերել ձեզ տեստավորվել, եթե ունեք ախտանիշներ։ Տեստը բավականին հեշտ է, տևում է ընդամենը 5-ից 10 րոպե և այն անվտանգ է։ Տարածաշրջանային տեստավորման վայրերում կան նշանակումներ և դուք կարող եք օգտվել տեստավորման վայրերը այցելելով covid19.lacounty.gov/testing։ Բուժ հաստատություններ։ Ես ուզում եմ ձեզ այսօր ասել այն քայլերի վերաբերյալ, որոնք մենք ձեռնարկում ենք ուղղված բուժքույրական հաստատություններում բռնկումների մեծամասնը և համոզվել, որ մենք անում ենք հնարավոր ամեն ինչ պաշտպանելու բնակիչներին և աշխատողներին։ Նոր տեղեկություններ, որոնք մենք հաստատում ենք, որ կան շատ ավելի մարդիկ, քան կարծում էինք, ովքեր դրական COVID-19-ի համար և հիվանդ չեն։ Մենք ռազմավարությունը այն է, որ համոզվենք, որ մեր ծերանոցներում մենք կարող ենք տեստավորել բոլոր բնակիչներին և աշխատակիցներին վիրուսի համար և այլևս չի սահմանափակվում միայն ախտանիշ ունեցող անձանց փորձարկմանը։ Սա մեզ թույլ կտա համոզվել, որ աշխատակիցներն ու բնակիչները, ովքեր դրական են COVID-19-ին, անմիջապես մեկուսացվեն և մյուսներից, նույնիսկ եթե նրանք հիվանդ չեն և կարող են օգնել սահմանափակվել վիրուսի տարածումը։ Մենք սերտ համագործակցում ենք DHS-ի հետ, առաջարկելու համապատասխան փորձարկումներ և այն վայրերում, ովքեր ունեն COVID-19-ի քեյսեր։ Վաղվանից մինչև մայիսի 10-ը սկսած 5 աշխատակիցներ կմիանան DPH-ին և դրանց դերը բուժքույրական հաստատությունների օժանդակելու և վարակների վերահսկման պրակտիկա կատարելագործելու համար է։ Վաղը երկուսը զեկուցում են DPH-ին։ Յուրաքանչյուր անձ 1-ից 2 շաբաթ կմնա այստեղ, իսկ ոմանք կարող են մնալ 2 շաբաթից ավելին։ Կան հանրային առողջության բուժքույրեր, որոնք շատ փորձառու և վարակի վերահսկման հետ շատ մեծ աշխատանքներ են կատարել։ 8 այլ բուժքույրներ, որոնք կվերապատրաստվեն վարակի վերահսկման և նաև կաշխատեն բուժքույրերի հետ։ Պետական առողջության լրացուցիչ 2 բուժքույրեր են պատրաստվում օգնելու հիվանդանոցներին։ Մենք նաև սերտ համագործակցել ենք EMS-ի հետ, անձնական պաշտոնական սարքավորումներ որակյալ բուժքույրական հաստատություններում առանձնահերթության տալու համար։ Այս շաբաթվա ընթացքում 2,8 միլիոն դիմակ, 8,000 զգեստ, 200,000 ձեռնոց, 50,000 դեմքի ծածկոց բաժանվում են ավելի քան 300 բուժքույրերի։ Կախված մաճակալի քանակից յուրաքանչյուր բուժքույրական հաստատություն ստանում է 5,000-ից 16,000 դիմակներ, միջինը 8,000 դիմակներ մեկ հաստատության համար։ Հիվանդանոցներում և ծառայություններում աշխատողները ծայրահեղ միջոցներ են ձեռնարկում, քանի որ մենք բոլորս մակարդակներ ունենք սակավություն։ Մենք շարունակում ենք գնահատել հուսալի բուժքույրական հաստատությունների կարիքները դրանց դուրս և կորոշենք անհրաժեշտ անձնակազմի և կամ ռեսուրսների անհրաժեշտությունը։ Ես ուզում եմ շնորհակալություն հայտնել բոլորին, որ շարունակել է հետևել Safer at Home կարգին։ Գիտեմ, որ եղանակը ավելի գեղեցիկ է և բոլորս ուզում ենք դրսում լինել։ Քանի դեռ դուք ֆիզիկական հեռավորություն եք պահպանում բոլոր մյուս մարդկանցից, պատճառ չկա եղանակից դուրս գալու և վայելելու համար, բայց շատ կարևոր է, որ չհանդիպեք այլ մարդկանց հետ, վայելեք դրսում մենակ կամ ձեր տանը անդամների հետ, քայլեք կամ վազեք կամ դրսում նստեք ձեր բակում, բայց հիշեք, որ ֆիզիկական հեռավորությունը մնում է նույնքան կարևոր COVID-19 տարածման դադարեցնելու մեջ։ Շնորհակալություն. Thank you. This concludes the press conference.
We're sorry, your conference is ending now. Please hang up.
You're good.